And from Pacific Cardiovascular Associates, I want to welcome Dr. George Tadros and Dr. Christopher Chen to our program.
Thank you for having
All right,
us.
so this is a new name, new kind of group for us, and you guys are over at Saddleback Memorial. So what is this partnership all about? Who are you guys, and what are you doing there?
Yeah. So we're very happy. So our group, PCA, has been around for about 30 years, but we're new members of the group. We have now a kind of a collaboration with Memorial Care to be a cardiovascular service provider for Memorial Care that offers both cardiac and vascular services to patients.
Okay. And Dr. Chen, you have I'm going to say electrophysiology. That's your specialty. What's the difference in terms of your specialty in that world?
Yeah, so Dr. Tadros, my partner here, he's what I would call a plumber of the heart, whereas an electrophysiologist is your electrician of the heart. And so it's somebody who specializes in diagnosing problems with either really fast heart rates, really slow heart rates, or really erratic heart rates, and provides treatments including medications, devices that we can implant like pacemakers and defibrillators, as well as doing a special procedure called an ablation, where we hunt down the arrhythmias and then try to get rid of them.
Yeah. So if it's the signal part of the heart is what you're getting in terms of the signal of how the heart's beating faster or slower, and then if I have a blockage, if I have some sort of valve issue, then I'm going to Dr. Tadros.
Yeah, to the plumber, exactly.
To the plumber.
Exactly.
Fix those pipes. Exactly. All right. So how does this partnership come about? Why does they already have heart surgeons at Saddleback. They already have people who do these things. So how do you complement what's going on there already?
Yeah, so we're definitely working in a community. There are multiple different groups, excellent physicians across the board in a lot of these communities. But what we pride ourselves as PCA is that we have a large comprehensive group that covers a large area of Orange County, covers a lot of different specialties that are available, but then also we try to take care of not just the heart, but also of the vascular system, because we believe the heart is needed to pump the blood for the vascular system.
So
between those, exactly. And also with the fact that for our group, we tend to, we pride ourselves that we take a considerable large amount of, or different kinds of insurances. So we're accessible to a lot of patients in hospitals as well as in geographical areas within Orange County. So this collaboration gives access to patients for our services, both for the heart and for the vascular system.
And Dr. Chen, when you're brought in, is there a special need that seniors have, or is something happening as you become older in terms of the electrical impulses of the heart, or do the pacing kind of get off a little bit as you get older?
Yeah, so basically, as we get older, there's a lot of symptoms. Some are more obvious for electrical problems, like palpitations, fluttering, racing, skipping heartbeats, having potentially some dizziness, or even like you passed out, you're about to pass out. These are especially when you don't have any warning signs ahead of time, those are very concerning for an underlying electrical problem. There's also symptoms that are more vague, fatigue. We always say, oh, I'm just getting old, but what does that really mean? And is it out of proportion to what's normal? And so all of those can, signify an underlying electrical problem that if we just don't look for it, we never know about it. And there are treatments for those things if we are able to actually look for those things.
And Dr. Tadros, for you, it's just, with age comes a lot of maybe buildup and cholesterol and plaques and things like that on the heart that have been building for years and years and years. So I imagine as in the senior community, you see a lot of that. Well, this is just, 40 years of, eating sausage and donuts.
Absolutely. And the thing actually about plumbing is that wherever blood goes, the blockage can happen. So that's one of the things we also try to look for, is that it's not only you're coming for us to assess your heart, because we also assess for blockages in the carotid, in the cerebral circulation, in the legs, because I always tell people, as much as we need the heart, but you always need the legs to walk around and move around and stay active, stay independent. So a big part of our focus is to keep people healthy on their feet for a long period of time. That's why diagnosing and assessing and treating circulation problems is a big priority for us. And we do it on a multiple different levels, whether it's the arterial or the venous side as well. So keeping feet healthy is an important call for us.
Right, because if the heart, I imagine if the heart's working harder to pump that blood through, and there are challenges throughout the whole cardiovascular system, then that's going to put a strain on the heart, and therefore
And vice versa, when the feet are not healthy and people are not exercising, then you don't get cardiovascular health. So it is a really close cycle, and trying to keep both of them healthy is very important.
Okay. So what are some of the common warning signs you talked about a little bit in terms of having heart rhythm problems? And would I literally feel it, like something's going on?
So most people do feel something. They feel like that palpitation or fluttering in the chest, again, dizziness or feeling like you're about to pass out or you are passing out and it sort of happens without warning. Those are probably the most obvious and concerning signs. Fatigue, again, is more of a kind of a vague, and it kind of goes under the radar. And we sort of, often will brush it under the rug and say, maybe I'm just getting old. But a lot of times it's actually somebody who has longstanding atrial fibrillation. And atrial fibrillation is the most common arrhythmia in the world. It's also especially important for seniors. Studies 20 years ago even found that 80-year-olds, 10% of them had atrial fibrillation. 70% of AFib happens to people between the ages of 65 and 85.
Okay.
And basically, folks currently, even in their 40s and 50s, now have a 1 in 4 lifetime risk for developing atrial fibrillation. So if this is something we're not really looking for, there's real treatments for it, and there's real implications of having the arrhythmia, including unacceptable symptoms, a stroke risk, and then also risk for heart failure, where essentially the heart pump starts weakening over time and it doesn't meet the needs of your body. And so there are real treatments for this, medications, blood thinners, and then ablations, where we go and try to take care of the arrhythmia.
Now, with the ablation, I'm going to, in layman's terms, you go in there and give it a little zap, and hopefully you knock out that area that's having the problems, or is it kind of reset it?
Yeah, so it depends on the type of arrhythmia.
Okay.
A lot of these we can hunt down, look for the actual focal source, and then we basically burn it away. Atrial fibrillation tends to be a landscape, so to speak, problem, where the heart has sort of had remodeling that has occurred over time. And so we use our catheters to deliver a type of energy that sort of kind of lays waste to it to kill off the electrical irritability so that the risk for it coming back is extremely low.
Okay. Now, Dr. Tadros, there have been innovations from since you got out of medical school to now. What are you most excited about in terms of the innovations, the things you're doing at Saddleback and other places that are just kind of life-changing and so advanced?
I think one of the biggest that we're seeing a lot of things about is treatment of venous, what's called venous insufficiency. So in a very simple sense, the veins are the blood vessels that bring back the blood from the leg back to the heart. They go against gravity. So in order for the blood not to be actually pulled by gravity, the skin veins have valves that are supposed to prevent that. In a lot of people, primarily because of genetic factors, because standing on their feet for a long period of time, and as we gracefully age, those valves start to leak, and the blood starts to pool down into the leg. And leaking veins, or what's called venous insufficiency, can cause a lot of symptoms. Part of it is like heaviness, throbbing, discomfort, swelling, discoloration. And it gets worse as the day goes by, and it gets worse as we gracefully age. The problem with that is actually as the skin irritation happens, venous disease is the #1 cause of ulcers in legs.
Oh, wow.
Not diabetes, not arterial. Venous disease, and it causes a big problem. And a venous ulcer takes 3 to 6 months to heal. It takes a long time. So prevention is very important. What's really cool about this in the last 15 to 20 years is back in the days when they used to have these leaky veins, it was a big surgery, what's called stripping, okay? And the recovery was really problematic. Versus now, literally, it's a clinic procedure, it takes 15 minutes, okay, through just a 1 needle access. There are different kinds of how to treat it.
Wow.
But it's 15 minutes. People walk out of the procedure, literally go to the golf course as long as they're wearing their compression stockings and can golf after that. The recovery is phenomenal.
Incredible.
We think this is an amazing thing, not just in treating symptoms, but also in preventing ulcers. A big message for today for a lot of the population. Stay on your feet, stay walking, and stay healthy. And a big part of the services is to screen for arterial and venous disease but more also, there is a lot of great interventions to treat it and stay healthy.
All right. I'd love to age gracefully. Dr.
Yes.
Chen, in the last minute we have left,
Yes.
what's the latest innovation you're most excited about in your field?
So for atrial fibrillation, again, a nuisance for everybody, including seniors. There's recent technological advances in how we do the ablation. So since the early 1980s, it was a thermal ablation, meaning you have an electrical energy source, you convert it to a thermal energy source. You're either cooking or freezing the tissue to kill off the electrical activity. And the problem with that is it's hard to prevent collateral injury to other vital organs, because as that temperature travels and you're cooking or freezing, it can also hit the other organs.
Okay.
So basically around spring of last year, actually, 2024, a new form of technology called pulsed field ablation, PFA, is what was widely accepted across the United States. It had been kind of going its course in Europe prior to that, but it's a newer non-thermal form of ablation. We deliver very high electrical field powers over the span of micro to nanoseconds.
Oh, okay.
So quick that it's very specific to the cardiac cells only. So it's equally as effective as the older forms of ablation, but much safer, much quicker. And I believe at Saddleback, they started that this past spring. And so the technology is there and ready. And basically, like I said, ablation has never been really safer or quicker than before.
Oh, that's fantastic. Pacific Cardiovascular Associates, embedded with the folks at Saddleback Memorial Care. Thank you, Dr. Chen and Dr. Tadros.
Thank you for having us. Appreciate it.
You're watching This Day. We'll be right back.